It feels like it runs at an angle.
Okay.
I'm sure you remember that. I need an excuse as to why something's not working.
So it's like a close.
Yeah, we're gonna have to start playing Sweet.
We look back this
Yeah, I adjusted mine a little bit.
There we go. I'm like a little square. I need it to be like.
This agenda, or just look at it and go over it?
You would have to come into our network to do it.
I just
so you probably have it.
The orientation.
Like you would have had to come into the
But I
network
don't know.
to do it, you know, so. it
I don't know that we need to, as long as everybody can see it.
All you need. I can't see you though.
Oh, yeah, I just moved it. I was showing you how to do it in an
Central and just fix my face.
Fidget things, yeah. Meredith likes to bring lots of fidget stuff.
Did you not know there was?
She's a
Look,
teacher.
video settings. Touch up my appearance. Yes, now I don't look so tired. I got rid of all my wrinkles. Ah, much better. Do you know how to do it?
It's like for your hair.
Do you want me to show you? It's lovely.
No, for your fever. It's a de-stressor. Look.
I didn't make that up.
Wait, how do you do it? And it feels good.
This is necessary.
Orientation on how to use the fidget thing.
Oh, yeah. No, so you go down here to this little arrow, video settings, touch up my appearance.
Help this one council member.
Yeah, 'cause my fingers are stuck.
It has all of this stuff in it.
I can't vote, my fingers are stuck in the fidget.
We're just like everywhere.
I wanted to
We're
say
like a sea of
static.
faces.
I can't
I thought
do
that's
it.
what it was first too, but.
Chinese finger. Look, all of this stuff is. These are the best. Just think of
Oh, my wife's the lock. Against the wood.
I do like milk that.
Hey, yeah, I was messing with it. I don't know. Is it back to the original?
Do you want mine?
This one's my,
Yeah.
Okay.
I've never seen one.
Got it, yeah.
And the finger was good.
I know, my car. Okay. Oh, yeah, these are my favorite. Why do we need so
All right,
many
I'm in.
fidgets?
I'm good, Heather.
That's really nice.
You're good? Okay.
All set? Okay.
That's like,
How much of it, like, fidget right?
I don't want any part of that.
I tried it.
They're magic.
I I thought it was like an earring of some sort. And it is.
Now we're ready? Okay. I will now call to order the study session meeting of August 2nd, 2021. Members of the public are invited to attend in-person council meetings in council chambers on the lower level of City Hall. Public access to tonight's meeting is also available on the Local Government Access Channel 8 for Comcast subscribers, on the city's YouTube channel online, and by telephone using the call-in numbers posted on the meeting agenda. Joanna, will you call the roll, please?
Mayor Leidy,
Here.
Mayor Pro Tem Wilford,
Here.
Councilmember Whitkovich.
Here.
Councilmember Peterson,
Here.
Councilmember Downing will be absent, Councilmember Brown will be absent, Councilmember Goff,
Here.
Councilmember Duran Malika,
Here.
Councilmember Lukman Hiramasa.
Here. All right, welcome. So we have quite a few agenda items tonight. The first one is the most important. We need to do kind of a mini orientation, a council chambers reboot, as it were. We haven't been together for, goodness, 16 months, about, roughly, which is a long time. So it is so lovely to see everyone. And I also want to quickly shout out to staff who did such a great job welcoming us all back with treats and joy. So thank you for that. We are happy to be together. So going through in your packet, there was a kind of a reboot mini orientation memo. And I know that everyone prepares for meetings, but I am going to go through and discuss some of the highlights specifically for the benefit of the public. So we want to make sure that everyone knows that it is a safe place to come back if the public would like to start joining us again in person. So based on the construction of our awesome rec center, if you haven't seen it coming along, it looks fabulous. Parking has been adjusted, so I think everyone figured out where to park, so that's good. And there's some great signage out there, so that's another thank you to staff. So if the public is looking for a place to park, there's lots of signs that help direct the way to a safe parking spot. The podium is located a little further away so that we have greater separation because we're still working on the, healthy COVID protocols. Our HVAC system was replaced in 2017. We have good air circulation, and then we have additional air purifiers circulating the air for us. The council chambers are cleaned before and after every meeting. We have hand sanitizer for all to use. Masks are not required to be worn, but any council member that would like to wear one still can wear one. And then, just a reminder for council that all of our meetings are broadcast live. And so this just reminds us about the use of the microphone inside conversations, because we got really used to using the virtual platform, and so we can't mute ourselves necessarily to either say something or even to cough. So we make a lot of noise because we can't mute ourselves. So these are just reminders. We have new chairs, so we gotta sit comfortably, get comfortable with the space. And so we used the Ring Central platform as a way to raise hands. And so we're gonna continue to do that. So if you can familiarize yourself with the Ring Central screen and find your raise hand feature, how about if everyone practices? And we'll see your hands are up, and then I should still have the ability to lower it. Yep. Thank you.
I don't know where it's at.
Okay.
Participants.
Participants? Okay, thanks.
Got it? Perfect. I think you were using different platform.
Oh, so this is what it has always looked like, most
Yes.
people. Okay.
Yes. Okay, so that is why you have a camera in front of you so that we can practice that. So that makes it a lot easier for me to see everybody and help keep the conversation flowing. Seems like we all got up and running, logging in with our email. You should have your vote ready to go. We're not going to be voting today, but Joanna, is it true that we're going to practice a vote?
If you would like to, we can do that.
I think we would. So what should we vote on, friends?
Are we happy to be back?
Yes, let us vote. That is the item on the floor. Anyone have a second?
Second.
All right. Joanna, will you open the vote, please?
The vote is open.
Okay, so I'm stuck. So I clicked yes, but how do I submit?
By clicking yes, that is submitting the vote.
Oh.
And so then
There we go.
council has the opportunity to change your vote up until I announce that I'm going to be closing the vote. So if you happen to click the wrong vote, don't panic. Go ahead and change it. And if you think it's about time for me to change the vote, just say, hey, give me a minute, and we'll make sure that that can happen.
Okay.
So then when I close the vote, that should clear it out.
Motion passes.
Oh, hey, then we have this. Oh, we have a screen in here. This is fantastic. 7 yeses, 0 no's. Fantastic. Okay. Well, that was fun. I do think it's interesting that this hasn't changed. However, it was as if it was brand new. I kept looking for the submit or send or enter.
It's been
Okay.
a while.
It has been a while. All right. Any questions about voting? We're good? Fantastic. You also should have, if you can find it, if you recall, it's been a while, the tabletop with the norms on it. So I would love to know if anyone would like to recommend a norm to focus on tonight based on tonight's agenda. So if you look at tonight's agenda, I'd love to hear from someone who would like to recommend a norm to focus on tonight. And I will look for a blue hand on my screen. Correct. Any takers?
So you want us to still raise our hand on the screen, right?
Yep.
You weren't here.
So Councilmember Goff.
Thank you, Mayor. I was going to suggest a positive intention, just because we're likely to be making some mistakes with the technology.
We're a little slow today.
You know, whatever, interrupt somebody or do something not exactly right. So,
I think that was an excellent choice. Excellent choice. Did anyone else want to weigh in? Do my pausing, the norm. But I see no one, so we will move on. Okay. Okay, council meetings, I'm just looking back at our notes. So we are going to use the dais for study sessions as well, partly because of this technology and partly as a COVID response for right now. Council member remote participation. For the electronic participation policy, council members have the option of participating electronically via phone or video, and staff will set that up. So that is another reason, as you can see on the screen with Ring Central, if we had a member that needed to zoom in, then we could do that. Staff attendance, staff and guests representing the city are going to be attending meetings in person. So thank you very much for that. Welcome to staff. I see quite a few of you with us tonight. Public participation, members of the public may call in to speak to city council or attend in person. If a member of the public chooses to attend in person, the individual will be invited to step forward to the podium at the appropriate time to provide public comment. The public may also provide comments by email or in writing. And so we've been doing that for the last year, and that has worked very well. Staff will use the podium when making presentations. Sorry, something stuck in my throat. If a council member is participating remotely, they need to view the presentation from the packet online in web docs. The presentation will not be on the screen. So that's just something to know. This is the big question, proclamations and presentations. Council will resume coming forward in front of the dais. Any council members not comfortable may remain at their seat. And shaking hands is at your discretion, but we have lots of hand sanitizer in the room. So when you reviewed this, were there any questions or concerns, or is there anything missing? Is there anything you want to elevate? Oh,
If I
yes,
touch the
and
sand
she's
or this
doing
hand,
it.
I'm just gonna do
Yes.
both.
No, this is great. Councilmember Duran Malika.
So I think one of the things that I think is just important to just mention is that if, folks are feeling ill, definitely encourage using the remote capabilities that we have now. You could still see everybody. Hopefully you could still hear everybody, just like you would if you were on your sofa at home. So we want to make sure that we're keeping everybody safe in the room as well. We are seeing an increase of people who are getting sick, really. So COVID and not COVID. So we just want to make sure that we're all staying.
Absolutely. And the other thing, goodness, I'm not sick, I swear. I think that's going to be the thing, right? You do have sanitizing wipes at your spot and some water. I did bring the fidgets, and I just wanted to kind of explain the purpose. It is part of adult learning theory, which we've talked about a little bit, but we, in the education world, but also I think in the business world, as everyone transitions back, there is a question about stamina and some sensory needs. I mean, we've been at home. We've been at home in a quieter environment possibly, in a slower environment, and it's just felt differently. So as we come back, and we are so excited to be back, these are simply tools. As I tell kids, they're tools, not toys. But they do provide some sensory pieces to help us focus as adults. And so enjoy. I have my favorite. So without any other questions, does staff have anything to add? Any questions or comments for us?
Nothing from me, Mayor. City Clerk Small, do you have anything? Or Bob? Bob Blair, IT Director, excuse me.
One thing I wanted to mention with Outlook, if you click on it on your desktop, you're logging into the web version to get your email. It'll ask you if you want to save your password, to save logins. With other boards meeting up there, you'd want to say no to that. So just make sure you log out of your email at the end of the session if you get into it.
Right. All right. Well, I am going to echo Councilmember Goff's sentiment that we are just going to do our best and get back on track and have some grace for all of us as we get moving. But once again, welcome to everyone. All right. Our second item, Colorado Communities for Climate Action 2021-2022 Policy Statement. Becky Smith, our Planning Manager, is here to present. Hello.
Hello, good evening, Mayor Lighty, council members. It's so nice to see everyone in person. It's been a while. So for those of you that I haven't had the opportunity to meet yet, I'm Becky Smith. I'm the planning manager in planning and development, but I'm also the staff liaison for the Colorado Communities for Climate Action, also called CC4CA. And I have been since the city became a member in 2018. Tonight, I'm here to discuss the 2021-2022 CC4CA policy statement. But first, I want to just provide a little bit of background about the organization for council members that may not be familiar with it yet. CC4CA is a coalition of 38 local governments across the state advocating for stronger state and federal climate policies. It is governed by a board of directors representing all of the community members. CC4CA has adopted by unanimous consent among its members a policy statement that guides the coalition's efforts. The policy statement includes promoting plans and actions that extend current authorities and provide new ones for local action, set new state climate protection goals, define and implement concrete steps to meet those goals, reduce carbon pollution through concrete new policies on electricity generation, energy efficiency, transportation, and waste management, and ensure that all Colorado benefits from the clean energy transformation. So every year, the Board of Directors revisits their policy statement to make sure that it still reflects everything that the members in the organization would like to advocate for in terms of climate policy. This year, CC4CA held their annual retreat to do this on June 4th. Most of the updates this year are non-substantive, meaning that they're mostly copy edits or wordsmithing of certain aspects of the policy statement. The two substantive updates include one that's dealing with solid waste, wastewater, and agricultural waste, and that is policy position number 24 in this statement. And the other is dealing with water conservation, which is policy position number 28 in this statement. Both of the policies are highlighted in the memo that went out in your packets. And now that the statement is finalized, all members of CC4CA are asked to go back to their communities and have their communities ratify that statement formally. I know both Mayor Pro Tem Wilford and Councilmember Goth have been very involved with CC4CA, so I'd like to invite them to add anything to the discussion at this time, and otherwise I'm happy to answer any questions you guys might have about CC4CA or this year's policy statement.
Mayor Pro Tem Wilford?
Thank you, Madam Mayor. It's a little, I'm trying really hard to focus and not raise my hand. There are two things that I would add to this conversation. The first of which is that the policy statement is adopted every single year and is, we work very closely with each member community to ensure that we are building out policy statements that everybody can agree to unanimously. So the document that you do have in front of you is something that we are asking every community to unanimously agree to. And then the second item that I would share is that this was reviewed by the Legislative Committee and did come out unanimously the committee came out with a supportive position. So I will leave it there and see if anything, see if there's anything that Catherine wants to add.
Councilmember Goff?
Yeah, I think that Councilmember Wolford pretty much covered it. We did, there are lots of discussions about it. It is some of the power and strength of CC4CA is the unanimous stand that we have for all our participants. And it's sometimes difficult to manage because some of our members are completely different needs and locations and geography and, that kind of thing. So I think I'm really proud of the work that CC4CA has done so far and the work on this. And I, as Councilmember Wolf said, we vote to support it in the legislative policy group. So I'm just hoping that it'll extend out to the full council.
All right, well, if there aren't any other questions, the next steps will be for this to come forward as a resolution at the August 9th meeting, ratifying the 2021-2022 policy statement. Thank you.
Thank you.
Councilmember Duran Malika has her hand.
I did, yes. Really, it was just a quick comment to thank Jenny and Catherine for all of your guys' hard work with CC4CA. There's a lot of meetings, a lot of action happening with that organization, and you guys done a great job of just representing Northland. So we appreciate you guys' work.
Great. Thank you, Becky. All right, so the next item is the city manager performance review process for 2021. And I believe there is a presentation. And it's coming up on the screen. City Manager Guyer, how are we feeling? Oh, I hit the next button? Ah! So accommodating to my controlling whims. Okay, so here we go. This is great. I've never done it from so far away, so okay. I feel like I'm punchy because I'm so happy to be back. It's crazy. All right. Okay, so a little bit, City Manager Guyer and I will be presenting this together, but I wanted to give you a little bit of the background and sort of where we are with this process. So if you remember last year, we talked a little bit about the process for the city manager performance review, and City Manager Guyer was able to go out and speak with some peers, and hopefully, I believe, we've created a process and a format that will be super helpful, and it will provide some growth-producing feedback for her and also some performance evaluation data. It's much more simplified, and it's much easier to use than the process that we've had for the last couple of summers. Okay, so in the simplified way, there's 6 categories, and there are 5 performance indicators per category. So for those quick on their feet, how many questions are there?
30.
30, Okay, so the category ratings will have point values that will lead to an overall effective rating. So you will answer 30 questions, but 6 of them will have point values. And I'm going to show this to you, and we're going to do it together so that it is not confusing. So it is easier to use. It is a Google form. We are going to take time to complete this during an executive session. We're going to do it together in the moment. It will provide a transparent process for all council members and also for our city manager. And the overall rating and the comments will be created collaboratively in one sitting. The growth-producing feedback and performance review data is from the review period 2020 through 2021. Heather will have access to all of the data, all of it. The raw data will go right to her, the performance indicator ratings, the comments, everything. The data will be collected in real time and leads to that rating. And because we're collecting all of the comments, we're gonna ensure that no feedback is lost during paraphrasing. So instead of having a facilitator that collects all of our comments and then sort of paraphrases what she thinks we meant, we are gonna all that raw data will be presented. So the timeline, just explaining the process tonight to council, but next week, we will receive a performance self-reflection document for review. So it is important that between the 9th and the 16th, that you take some time to read that. We will have an executive session on the 16th, and that will be the actual city manager performance review process. And then the following week, we will meet with Heather and have that final review conversation. So the council process for the 16th, that's when we come together. In our executive session, you will receive the link to the Google form. And because I can be a nerdy teacher, I'm gonna show you how to do it. I'm gonna model it for you, and we're gonna do it together. So that there's no confusion, because sometimes we can kind of get lost independently. So we're gonna do it all together. I'm gonna show you how to do it, and you will provide feedback in the 6 categories on the non-rated scale. So that's, I'll have an example in a minute, but the don't know is data, and I'm gonna show you what that means in a minute. But we don't want you to be afraid to use it. So for the questions that do not have a number associated with them, I wish I had an example, let's see. Perfect. So here's an example. This is an actual question, and it says, if we're saying our city manager creates opportunities for the city to shine through articles, speaking opportunities, leveraging grant funding, hosting workshops and meetings, applying and receiving awards. So you're gonna pick one of those, okay? So she either does it well, she's on track, she needs improvement, or I don't know. And the I don't know is super important data. And so for council members that might be new, might be newer, if you are in that place of I don't know, that's okay. That gives her information. And, you know, let's say hypothetically that none of us know the answer to this. Well, that's really important, right? And she will get the raw data so that she'll know which one of us doesn't know, if it's just one or two, and that can be work that is done. And so then you will look through your own feedback and submit an overall score for each category. So if I have 5 questions that look like this, then I'm going to go back at the end of that category, and I'm going to say, okay, based on how I felt about those 5 questions, this is going to be my overall rating. So exceeding expectations is a 4, needs improvement is a 1. And there is intentionally not a center. So if you know anything about data, that was done on purpose. Okay, then the final evaluation scoring. So a maximum score in each category is 4. Maximum overall total points is 216, right? So if everybody gave her straight 4s, she would get 216 points. And then mathematically, the overall ratings will just be generated. Question. Comment. Looking at my blue hand. Where's your blue hand, Randall?
Well, you know. You want to wait an hour for me to find it or just ask?
lost it
There,
too.
hold on. There.
Councilmember Peterson.
Thank you, Mayor. I appreciate that. I like the system. It's a lot better than last year. It's simple. It doesn't go through 1,000 different filters. And I appreciate just personally the streamlined aspect of this.
Awesome, thank you. Councilmember Duran Malika?
Yeah, I'm really looking forward to this process. I think it's actually going to help logistically to lock us all in the room and get it all done at one time. I think that's probably the most time effective way of managing this process, is because then it's always like so-and-so didn't fill it out and it's been 2 weeks. And so we get it all done at one time. And then I feel like we could have a really good conversation with each other about why we chose what we chose, which was always hard to do previously because, you know, I don't remember why I put a 4 versus a 3 or something. And so I think that that process is going to be really great. And then really, I think that just generating feedback would just be really helpful for, you know, everybody, make sure that we're being concise.
Oh, one piece I may have skipped. There is a section for comments, but just one.
Not for every question.
Not
That's
for
helpful.
every question. Councilmember Goff?
Oh, thank you, Mayor. The question I had was, when I looked through this before, I guess there were a few items, you know, being relatively new. I wasn't exactly sure. So would the recommendation be then to like send an email to ask what, give me some examples of what those are before we meet next time, or?
Can you clarify your
Okay.
question? I'm sorry. Just give me an example.
Well, like I know I'm looking at the strategic priorities and policy decisions, or there was something about, you know, like decisions and running the city that maybe I'm just not involved in all the time.
Okay.
So, I don't know, maybe that wasn't a very
Oh,
good
so
example.
you looked at the.
Yeah, I looked at the actual questions, yeah.
Got it, okay.
You know, so I'm just, or even the example you gave about the articles, and I mean, I know about some of them, but would it be appropriate to ask her ahead of time, or?
What I would do is I would wait.
Okay.
Because she's going to submit a document to us next week that is going to give us a ton of information.
Okay.
Definitely, I think that's the only homework piece that's super important,
Yeah,
is
sounds
that
like
you make sure that you review that
Got
before
it.
the 16th,
Sounds great.
because that's going to have a ton.
That helps me.
City Manager Guyer, did you want to add to that?
No, I think you were spot on, Mayor, in saying, I'm going to, those of you who were on council last year are familiar with the document that I submitted to you last year, which was a step up from the year prior. So my hope this year is to pull together a document, we're calling it a self-reflection document, that really connects and aligns to the questions that you have. But when in doubt, make a note and bring that up either in advance of your session with council as a whole in doing this work, or nudge me, and I'll make sure that all of council gets that information prior to that session.
Okay, sounds good, thank you.
Mayor Pro Tem Wolford?
Thank you, Madam Mayor. Just a comment in that I feel like over the last 3 years that I've been able to do I guess, an evaluation of a city manager, it's always felt really clunky. And I feel like this is the first time that I've seen a process that feels like it really fits where we are and what our city and our city manager needs. So thank you for all your work and putting it together. It's really fantastic. I'm excited to give it a try.
Me too. Do you want to add any?
Thank you, Mayor. I would add a couple of comments for council's benefit and that of the public. When you hired me, I stressed the importance of continuous improvement and continuous learning. So having an annual performance review is important to me. This is a very unique review. There's no other city manager in the state of Colorado with this review. Now, after we use it and really refine it, there may be other managers that want to model theirs after my review, but there's no right way to do it. The big thing for me, or I should say there's no right tool out there. I looked at probably 20 plus reviews of managers across the state as well as the nation of colleagues that I served with on the ICMA executive board. So I really tried to take what I liked and what I thought would be important in terms of the feedback process for me. A piece that isn't written anywhere in this memo that I'll share verbally with you is it's really important for me to hear from each of you through this review process. One of the things that in reflecting to past reviews is, may have heard from, say, 5 council members, but I am making an ask that I hear from each of you through this review process because each of you are one of my bosses. So it's important to have that connection. And I'm looking forward to this process. I appreciate the mayor's leadership and collaboration in pulling this together, and I hope it goes well. Thanks.
All righty. Okay. So we are now moving into Crisis Response Unit Pilot Program Proposal. Rupa Venkatesh, our assistant to the city manager, is here to present this item. Do you want this?
Yeah, I'm trying not to.
Yeah. That'd be embarrassing.
All right, good evening. So as the mayor mentioned, my name is Rupa Venkatesh. I'm the assistant to the city manager. And let me get to my presentation. So with me tonight, I have Jessica Holtz, who's our community resource navigator, and she'll be doing the bulk of this presentation. And then towards the end, you'll hear from our police chief, Jim May, and our planning director, Brooke Sabota, who's here with us tonight. And then also joining us on her vacation remotely is Municipal Court Judge Amanda Belhash.
All right.
So just to start off, during the February 2021 Strategic Planning Council retreat, Council prioritized 8 ideas. And 3 of those ideas directly correspond with the pilot program we're going to be presenting tonight. The first 2, the PD co-response program and the restorative justice program, will be evident as we go through the proposal. I also included the EB Raines Junior Memorial Park safety concerns priority because during council discussion on July 12th, the concern for homeless individuals was discussed, and it was also suggested that we continue to utilize the Community Resource Navigator program, who's proposed as part of this pilot program, and this pilot program also expands on what the existing program already does. And I also wanted to include another idea that was proposed during the retreat but not prioritized, and that's about the community navigators complementing code enforcement. And many of the folks that have code violations could remedy their problems through a different program. So the Crisis Response Unit program incorporates some of that. Before I turn it over to Jessica, I do want to mention that this pilot program is going to fall under the city manager's office.
And the reason for that is that this program is a tool for more than just the police department. As you can see by the list here about the different departments and divisions that this program will affect. The other thing I want to emphasize is that this proposed crisis response unit is customized to our needs as a community. You'll hear a lot about the research that we've done in figuring out what other crisis response units across Colorado does, but I do want to also let you all know that we did listen over the last year to what council's needs are, what our residents' needs are, businesses, and all of these departments and divisions to really understand what our community needs. So with that, I will turn it over to Jessica.
Thanks for having me. So the proposed crisis response unit has the mission to that it will work to ease hardships for residents of the city of Northglenn by aiding police response and creating a path for self-advocacy through the use of an on-scene crisis response team, case management, and conflict resolution. The objectives of the Northglenn Crisis Response Unit would be to support residents through the on-scene efforts of aiding those police officers and providing follow-up case management meetings. We would, or the crew would also work to decrease office response times on calls. They would support conflict resolution through the use of mediation techniques. They would increase community partnerships by looking to streamline pathways to mental health services, physical health services, as well as financial resources for residents of Northglenn. And they would reduce community threats and severe intervention, meaning the use of M1 holds. So when looking at teams across Colorado, I turned to the Colorado Health and Human Services Office of Behavioral Health, which they partnered with the Colorado Health Institute to do a survey and research and to assess the different response teams across the state of Colorado. The Office of Behavioral Health chose 8 of the 25 funded programs, and those 8 all agreed to use the same data reporting tools to allow an assessment to be completed between 2019 and 2020. From that assessment, we have the following data, that 55 of 246 law enforcement agencies have a co-response team as of 2020. Some local ones around here are Denver, Broomfield, City of Boulder, as well as Boulder County, City of Longmont, Westminster, Louisville, Erie, Douglas County, Arvada, and Lakewood. All of these crisis response teams, according to the Office of Behavioral Health, work to find alternate paths to resolution rather than just detention. We're calling it the Crisis Response Unit. Most often it's called co-response teams. Co-response teams work to pair clients with appropriate resources to aid in mental health and self-advocacy. And according to the Colorado Health Institute, co-responder programs improved interactions between law enforcement and community members. It was noted in the report that there were a couple of barriers when looking at crisis response teams. These lied in the lack of policy alignment between law enforcement and the behavioral health providers, the data collection challenges when confidentiality played an effect on that, and having limited resources to increase staff. All of these barriers were taken into consideration when we created this proposal for the city of Northland to identify the unique needs of the city. When looking at crisis response teams across the state of Colorado, we have some data in numbers because the report offers qualitative as well as quantitative data. The average number of calls a responder by the co-responder teams per month averaged from 19 all the way up to 164. The actual number of interactions that they were able to provide per month were averaged from 19 over to 103. And then the rate of calls responded, that's looking at the number of total calls that the police department had come in, as well as the number of calls that the crisis response teams were called out to. So that's the rate per 1,000 calls of total calls for the entire police department. I'm not quite sure why Weld County didn't have its actual numbers per 1,000, but they calculated using a different county with a similar population size. That is to say that those were the on-scene response calls. They also have something called the after response calls, and that is when a police officer responds to a call, does not call a clinician to the on-scene, but then actually refers that client to the crisis response team, and that crisis response team is able to follow up to that individual's home or wherever they're staying. Sometimes it's going to be to a person experiencing homelessness as well. So it is also noted that some counties and some cities actually responded to more after the fact calls rather than actual on-scene response calls. I included this data because it does demonstrate the need to have that capacity to respond after the fact as well as to the actual scene. The report also noted that the teams have a much higher impact when more contacts are made per individual. So this is called high utilizers. High utilizers are clients that were contacted more than once per month. When a person was contacted twice per month, their rate of engagement being connected to a community resource was around 35%, whereas when a person was contacted at least 3 times, their rates jumped to 68, a little over 68% of community partnerships and engagement. And that speaks closely to social work in general. The more contact points you can have with a client, the more trust is built and the more connections are made with appropriate referrals. When looking at crisis response teams across the state of Colorado, there are 2 main ways that are used, and this is not indicated on this slide, but I'm going to talk about it real quick. One's called an internal response and one's called an external response. An internal program is when a police department actually hires their own social workers to be a team within that unit. An external response is when a police department decides to partner with a public mental health agency or mental health clinicians that are part of a different practice. When I went around talking to a couple of different co-responder teams. When I was talking to their directors, I talked to some that had started out with that external model and then moved to that internal model, because when we look at the barriers that I first mentioned of having data collection problems as well as difficulty creating that communication between law enforcement as well as the clinicians, then that external model helped provide those barriers. When the clinicians were actually hired on as colleagues as of those police officers, then that communication improved, as well as levels of confidentiality or the problems in data collection were minimized. When we're looking at this graph right here, the type of response, so these are the different counties and cities that the Office of Behavioral Health provided data for. When we're looking at the different types of response, you're seeing primary or secondary. Primary means that they have moved to a model where dispatch can call just for clinicians and not the use of law enforcement first. The secondary response is when an officer is always called first to do a safety assessment of the scene, and then the officer themselves makes a request for a clinician to join them on scene. As you can see, some utilize 2 different ones. Some of them are just primary, some of them are just secondary. And for Longmont, I'm going to speak about them. They have a totally different model where they actually staff entire cars. One is a law enforcement, so there's 3 people in 3 different cars, and there's 1 law enforcement, one medical responder, and then 1 mental health clinician as well. And then they're staffed 24/7 out of the week. So that's their model. It's a unique model. Referral sources are typically from within their cities, so law enforcement, emergency services, as well as fire. Some only allow for the police to respond, and a lot of times the ones that are only allowing for the police to call for that response are the ones with that external model, because that's where that partnership is. It's a partnership between law enforcement and the external mental health clinician practice. Some of these allow for case management, some of them do not. And when I'm looking at case management, I'm also looking at those after the fact calls. So allowing someone to be called to a scene after the fact, making sure that that person has received wraparound services. So talking about that multiple contacts per person, making sure that that appropriate referrals are being made and that the person has access to being able to apply for those certain programs. And then the different types of calls that are looked at across the state of Colorado. When they're saying all, I don't really know why they're saying all. They're certainly not being called to scenes where it's just safety. But that's the way that they described it to the Office of Behavioral Health. Most of the times, those are going to be mental health calls is what they're being responded to out of the ones that I've talked to. And I believe when I read something about the exhausted parents, which is under the Larimer County, that also is just family conflict and families that were experiencing some dysfunction. So this takes us to the model that's being proposed for the city of Northglenn. Our potential crisis response unit, also known as the Northglenn Crew, we would be responding to calls such as welfare checks, unwanted persons, mental health, DVs, family disturbances that aren't rising to the level of criminal activity. And then the crew would also respond to calls from code enforcement that do not rise to the level of health and safety. And then we would also respond to clients that Judge Bailhash would recommend that are clients of hers that are having a difficult time meeting their court obligations. To back up, the police department calls that the crew would be responding to, one is the welfare check. Right now, or in 2019, according to our own police data, that those calls took up 19.39% of our police officers' time, and they responded to 1,404 welfare check calls. Unwanted persons is when a person is either loitering or hanging out or potentially trespassing. A lot of these are regarding people experiencing homelessness and the calls that the police officers respond regarding that population. Those types of calls take up 7.87% of our officers' times, and the officers responded to 744 of those during the year of 2019. Mental health calls, it is unknown the percent of response time in 2019, but there were 342 calls that specified mental health in the call log. And then DV/family disturbance. So there's two different distinctions here. One is domestic violence and one is family disturbance, which does not rise to that level of domestic violence. So when we're looking at domestic violence, that took up 16.15% of our officers' time, but it's unknown how many exact calls. And when we're looking at family disturbance, we do not know the percent of time, but we do know that 204 calls were made in reference to family disturbance. As an addition, in 2020, so the next year, there were a total of 267 calls that were coded as either an M1 hold. And if you're unsure of what an M1 hold is, it's when a person can be placed on involuntary hospitalization for mental health for up to 72 hours by police officers or medical response teams, or for mental health calls. Creating the Northglenn Crew would require some additional personnel, and that's noted in this organizational chart. As Rupa said, the program would stay under the city management department, and Rupa would be at the top of that. It would be the person to report to. The new personnel would come in the form of a program manager that would require a full FTE, a co-responder, which would require a full FTE, a 3/4 co-responder, which would be 0.7 FTEs, and then the community resource navigator would stay the same, which is what's already being, that position is employed right now, or filled right now, and that would stay at 0.5 FTE. The daily operations of the Northglenn Crew, It would primarily be responding to calls alongside officers or those after-the-fact calls that are referred by our officers. Those calls would primarily stay within the mental health realm, as well as address suicide ideation, as well as family disturbances. The crew would also provide wraparound services, including connections to community resources, as well as mental health support, and hopefully be able to streamline those processes, because right now it takes a lot of self-advocacy to be able to engage in proper care. So hopefully the crew would be able to work to help our residents out that way. Conflict resolution would also be provided for code enforcement, and this comes in the form of calls that come into code enforcement that don't really rise to that level of health and safety, but the residents still need help in creating a pathway to conflict management usually between neighbor disputes. The crew would also work to create a juvenile restorative justice program with Judge Bailhash, which is a program that she has said would help a lot of her clients. And I believe that program was also highlighted as a priority by City Council. The Northglenn crew would also work to provide community outreach, and that is going to be through self-referrals. If a family is having a hard time, they could turn to the crew. If mental health is having a hard time getting in touch with a client, or if courts are having a hard time getting people into court obligation, fulfill their court obligations, they would be able to also contact the crew and have assistance in working with those individuals. The crew would also create partnerships with schools, with our hospitals, with family members and significant others to facilitate referrals for community-based services as well as treatment. And the crew would provide case management for those clients to make sure that follow-through was happening. When looking at a referral flow chart, the court, Judge Bailhash, and her clients would make a direct referral to the program manager. Those people are most likely have already gone through a screening process. Their needs are most likely known by Judge Bailhash, so she would be able to make a direct referral. The police department and code enforcement would be able to make direct referrals to the co-responders, and those co-responders would be able to share that load of clients by providing case management, by responding on scene, by responding to calls for service. And then self-referrals, as well as people experiencing homelessness or community members that wanted to touch in if they had concerns about other residents, would be able to utilize the Community Resource Navigator as they currently do right now. When looking at the FTEs that are needed, it is noted on here, the reason for 2 co-responders is 1, to be able to provide 5-day coverage, as well as provide that case management. If a person is expected to be a first responder or a secondary responder, that's going to be an emergency service, that person's not going to be able to schedule their own case management meetings, because that emergency service is always going to take priority. By having an overlap of 2 days, those case management meetings, mediation, neighborhood mediations, and restorative justice programs would be able to be tended to. The program manager would work a typical 40-hour work week, 5 days a week. The full-time co-responder would work 4 10-hour shifts. The second co-responder would work 3 10-hour shifts, and the Community Resource Navigator would work a part-time, probably 5 days a week, whatever the needs were looking like at that time.
Jessica, can I ask you a question while you have this up here?
Yeah.
And I don't mean to interrupt your presentation, but just to be clear about this a little bit, are we envisioning these co-responders and staff people going out with police on calls?
That's correct.
Okay, and so other questions related to that, but this is a Monday through Friday, 9 to 5 type of schedule. So
the
weekends, evenings, how do you envision that?
Sure. So the program manager would not be responding. They would be able to play backup for those co-responders. The 2 co-responder positions would be responding. And I'm going to get to that by analyzing our call data logs on what appropriate hours they would be working. But mimicking officers' call response times and also working with Commander Waltz, I've come up with these hours.
Okay, so do you envision for the times when somebody is not on shift, that, you know, a referral would be made to a staff person then later to follow up during
That's
these
correct.
business hours?
Yes.
Okay.
For example, right now, when a call is coming or a referral is being made by our police department, right now it's going to that community resource navigator position, and that typically happens through email or a phone call.
Okay, thank you.
Yep. So looking at that call data log, that's where these hours came from. These are our police call activities by day of week. When we're looking at community calls versus officer calls, community calls are calls that were initiated by the community. When a person calls either the non-emergency or the emergency 911, that's referred to as a community call. And when an officer initiates a call on their own, that's the red bar, and that's called an officer-initiated call. So looking at the days of week, the Northglenn crew would be a Monday through Friday position. And I'm going to go back to that barrier that I talked about in the first. One of them said increased need in staff. This Northglenn Crisis Response Unit has been written where it's not anticipated that an increase in staff would be needed. It's written to be a comprehensive and robust program from the beginning, so hopefully no new FTEs would be needed for the foreseeable future. So that's the intent of writing it with that 1.75 FTEs dedicated to responding along with the police officers. We also said that this is not written in stone yet because as the program developed, it might need those co-responder hours to shift back and forth a little bit. Maybe it's not 8 till 6, maybe it's noon till 10, that sort of thing. So those things are not written in stone yet, but this is what we've come up with right now, analyzing the data from the previous year. And then if we look at call by time of day, this program was written in response to the community-initiated calls, not just the police officer-initiated calls. When looking at individual responsibilities for the different members of the Northglenn crew, the program manager would be the point person for the crew. They would also work directly with the courts to provide case management for the court clients. They would be the community partner liaison. They would also assist those co-responders, as I said, but they would not be the primary co-responder. They would also work to implement a juvenile restorative justice program alongside Judge Bailhash. The 1.75 FTEs that are dedicated to the co-responder full-time units would be the on-scene response that we were talking about, the case management for clients that are referred through the police department, as well as the community resource navigator. And I'll show that flow chart in just a second, as well as any case management that's referred through code enforcement, and they would conduct community conflict resolution for code enforcement as well. The community resource navigator would be the point person for the self-referrals, as well as the person experiencing homelessness liaison, as well as maintain those office resource hours. By being a person experiencing homelessness liaison, that's not just a case manager for people experiencing homelessness, but that person also works to maintain relationships throughout the different municipalities, as well as Adams County, to maintain best practices for outreach services. With that, I'm going to bring Rupa back up to talk about budget.
All right, so the question in the room, how much is this going to cost and how are we going to pay for it? So our budget that we're anticipating, as Jessica mentioned, is a full-time program manager and an addition of 1.75 co-responders. And as she also mentioned, the community resource navigator, we do want to maintain that position as part-time. So the initial program operating costs, that includes one-time cost for furniture, as well as a one-time cost for software, but ongoing, there will be a software cost. So the ongoing program cost plus the personnel, we are estimating that to be $330,000 annually. And some potential funding sources. So staff did apply for 2 community-oriented policing services, which is what COPS stands for. We applied for 2 grants. One of them will pay for the co-responder positions for 1 year at $125,000. The second COPS grant would pay for the full-time program manager plus some of the operating costs, such as the software cost. And that grant is a 2-year grant at $125,000 each year. There is potential that we could receive both grants, and that award starts October 1st, 2021. So we should get notified of that grant hopefully by the end of September. Another potential funding source is ARPA, which is the American Rescue Plan Act funds. There's a specific category in ARPA that calls out public health, and even more specifically in that public health category, they speak of behavioral healthcare services, including crisis intervention and related services. So we feel pretty strongly that this program, this pilot program, could qualify under that. I do want to mention, though, that it is not recommended to use ongoing program costs for ARPA, which is why we are proposing this as a pilot program. So if council does decide that they want to use ARPA funds for 3 years, we could do it as a pilot program. And when we hire these positions, it's hired as a temporary grant-funded position, which isn't entirely uncommon. And then council would make that determination in year 2, how you want to fund it, if you want to continue to fund it. And then also the Office of Behavioral Health, it's a state grant. The cycle opens every 5 years. We're in year 2 right now, so we're a little bit off from that. OBH also received $94 million in June of this year in federal funds. We're not sure how they're going to allocate that money yet, but we'll be on the lookout for that. And then there's also, of course, general funds. There's the potential for that. So at the end of this presentation, we'll go back to the slide and ask if you want to consider using ARPA funds or not. And now I will turn it back to Jessica.
So when looking at a pilot program, we want to know how it's going to work. So how are we going to measure the success over something that we have not tried yet? It's a good question. So one, we would need to look at the community awareness of the Northglenn crew. And there are thoughts on that. One short-term goal is to create a vulnerable resident sticker campaign. And that is when a person can choose to identify if they have vulnerable residents living within their household or driving their cars. So for example, if a resident is a person that is deaf, then they can have a sticker that identifies them as so. So when an officer pulls them over, they're able to self-identify and the officer has that information when approaching their car. Also, if a person is has mental health disorders or physical disabilities that prevent them from responding to their home quickly, they're able to have those stickers on next to their front door so the officer understands who they are approaching when they get to the residence. We would also be working to track metrics through using the software called NowPow. NowPow is set up to report on the Office of Behavioral Health grant data that they need. And so if we were to look at extending or looking at those grant opportunities, then that software program would allow us to automatically be able to report on the statistics and data that they need. The crew would be looking to see if the residents have access to follow-up treatments and other resources, if they're being appropriately referred to our community resources. What is the Northland crew reducing the number of code violations an individual household is receiving? Many times when a household is receiving a violation, it's not just the first one, but so working with those residents to access resources to help them take those violations down. And then also has, like I said, has the Northland crew streamlined referral systems within the city of Northland and Adams County to get the assistance to where it's needed in a timely fashion. Oops. So looking at measuring success, the year one goals would be to maintain what the Office of Behavioral Health found, which was an average of 33% of clients getting connected to resources, providing 6 successful neighborhood mediations, as well as 3 successful juvenile restorative justice outcomes. And the year 2 would be looking at, in that year 1, we'd also be gathering data of the actual numbers that the crew is responding to. And then year 2, we would be looking to reduce those numbers of high-frequent calls to households, as well as doing a 10% reduction in the mental health holds, which is, again, that M1 hold I talked about. And this is not an exhaustive list. It's just an example. When looking at the crew, this program has been researched now for the past, since January was when we started looking at it, little bits here and there. And since then, we've reached out to different advisory boards to see what their thoughts were, if they had input, and what that looked like. So far, the CCPP advisory board has been turned to, as well as the DICE advisory board. SCL Health did have a meeting to look at what having a co-response team could look like with a partnership, and they were very excited to partner to increase service utilization, as well as provide accurate referrals for appropriate care. And then Adams County has also seemed excited to provide a streamlined referral access to services, and that's coming from working with people who don't have access to internet and or phones to be able to do their self-advocacy and apply for benefits. The Adams County has started to create a call-in, like a bypass call-in line, so we can get meetings attended to directly. And that's just the start. So in looking at what's being proposed tonight, this is the proposed Northland Crisis Response Unit program.
So we'll leave this slide up, and we'll call on Chief May, who wanted to say a little bit about what this would mean and how it would impact the police department.
Mayor, Council, good evening. I know this has come up, actually, I think we've been talking about co-response team for several years, right? I know I've heard from several of you that this is something that you would have liked implemented. Did look into it, and it was an external program with one of, with the Reach Center, see if we can go in there, see how quick we can get it up and running. Again, as Jessica stated, that was an external group to come and assist. But at that time, we didn't have the resources to actually put that together. And then this last year and a half, some things happened with COVID and George Floyd and all the other stuff that was going on kept our department pretty busy. One of the things that I really want to talk about, how important I think, when Jessica sat down, she just has done an incredible job putting this all together and building that strong foundation. But when you're talking about the internal program, why is that? I think it's such a benefit to us, because this, they share the same mission, vision, and values we do, because they're us, right? So I think that's very important when we move this program forward, and compared to an external program where they might not have the same mission or vision that we do as a city. So I think that's very important. One of the things too, as a young officer, when I was responding to calls, and we would go in and, again, law enforcement, you expect to be the protector, the counselor. So we had put on a lot of hats. However, when we went into people in crisis at their residence, we would go in there, diffuse, de-escalate the situation, and then we try to, give them the 15-minute counseling session before we left to go on another call. And then, after a while, things might settle down, but then, get repeat calls and everything else. This is an opportunity for us to really give that extra service to our community and those that are in crisis, right? So it's going to be a resource guide. And I think, truthfully, I think we've had a pilot program over this last year and a half with Jessica, with the homeless Navigator that she's been out there, been spiking. So we'll be able to put resources to those things as well. So, but again, I think another measurement tool would be the utilization by the officers of crew to help them do their jobs better. But I just wanted to come out and just say I'm in full support of this program, and I'm hoping we're able to pull it off. So, but again, Jessica and Rupa, they've done a fantastic job, so.
And next, we have our municipal court judge, Amanda Bailhash.
Good evening, Mayor, City Council. I also wanted to put all of my support behind this program. As Rupa mentioned, I'm appearing via Ring Central today because I'm on my vacation, my summer vacation right now, but I believe wholeheartedly in this program. And I think the things that will bring this community will go beyond kind of the data-driven piece, which is, I know we have to have metrics to measure our success, but I agree with Chief May. Since hiring Jessica as a community resource navigator, we've really seen kind of how a program like this can really benefit our community. And it is astonishing. A lot of you know my background. I was a public defender for 13 years before I left taking the bench. And the things that Jessica has been able to do in the last year in working with the clients that I've sent her way are remarkable. And I believe they're life-changing for some of her clients. For some of their clients, it might not be life-changing, but at least they know what's out there now. And I don't think they're as scared from the system as they used to be. So being able, from a court perspective, to take advantage of crew from a case management perspective, I think it's so helpful. And what we really saw, and I don't know if Brooke's going to talk about it, but we've been able to use her beyond our criminal behaviors, right? So she's working with people that are experiencing homelessness in the court system. They're getting charged with things like trespass and open alcohol container and camping. And we've used her also with some of our chronic code violators. Some of that population aren't kind of the life-changing that we all hope to see, but just connecting them with the resources. And for some of them, I think it is working. And the way, of course, I was always in support of this program, but really seeing how this program can benefit from the court perspective really started at a meeting that we had in February. In our February meeting, we, you have to wait, Mark. Sorry. In February, we had a meeting about building a restorative justice program, and I asked Brooke to be a part of it, and Jessica and Rupa and the chief, and a lot of the things that I was thinking could work for restorative justice program, Rupa and Jessica were like, well, we can do that in this program, check. We can do that in this program, check. And it was really exciting to see the way that, and also another reason why I wholeheartedly support it being under the city manager's office, because it creates that separation between the police department and the court and code enforcement. And so it's kind of the centralized place for all of us to serve our community while we can all stay in our own departments. I know the chief is also excited about juvenile restorative justice programs, and he's somebody I would absolutely want to partner with also with the crew program, and to see how that we can use that best. But I see this really working well for our community. We have such a small community, and we have a lot of residents that can really benefit from this this type of program. So I just wanted to appear today and share that with you.
Thank you. Great, thanks, Judge. And last but never least, Brooke.
Good evening, Mayor and Council. It's nice to be back up here at the podium. Been a minute. Also, Rupa's assured me I have 52 minutes of time. She promised me that. I know, Heather, I'm going to take a few.
You didn't get the slide.
I'm just going to take a few. So I've been handling code enforcement, I've been here for 10 years, and in that 10-year period, we have done nothing but fill gaps, and we have failed in many instances. We tried a mediation program, which is conflict resolution, which is mentioned in this tonight. We've also struggled mightily, and I also want to point out that PD has post-certified officers who are trained in handling mental health issues and homelessness to the scale and ability that they can within their position. Our officers don't. And we deal with these challenges moreover than I would say disproportionately than we would otherwise do that. And when we have worked with other groups and organizations, we're falling short because we don't have the proper skill set to really understand how to do this. And so from my perspective, we're feeling a huge need in terms of level of service as an organization, but also for the community, as Chief had mentioned, and so did the judge. But I really want to kind of bring home that, you know, we've had situations where we've had folks that have mental health issues or they have deteriorating health issues, and our ability to really help these people has been an extreme challenge. And when we talk about staff resource, I mean, myself and the code supervisor, I mean, we've had to coordinate with the judge where we had a court-appointed attorney for an estate where the gentleman had mental health issues, and we're having to charge the attorney because we can't serve this individual because of their diminished capacity. Having this crew type of program, we probably never even get there. And we worked with the Reach Center. We had one case where we went working with the Reach Center for 2 years on our staff level, and we were unsuccessful in really being able to help facilitate that. So to me, this type of program fills a huge hole in what we have tried to do in our best efforts. And I would also argue with PD. It's like when we go out to deal with a case, whether it's PD or code, we're there to solve a problem. If there's a trespass, we're not looking at why there's a trespass. We're looking at we need to stop the trespass. We deal with that with homeless camps on the code enforcement. We're not looking to how are we going to find a place for these folks. We're trying to resolve a problem. And I think what we've done as staff who really want to do good for the community, we try to do more, but we're not the right resource for that type of effort. And so to me, looking at this type of program really brings home an opportunity to fill that gap. And I know that council's expressed an interest in this in the past, but I really see this as really integral to making our jobs better, because when we have those resources for conflict resolution and for all these other challenges that we face in this community, and now for me as a director, I know we have the proper resource with a program like this. So thank you for the 52 minutes. That's all I really need. All right, thank you.
So with that, we will open it up for questions. So the two big feedback that we want to hear from council is whether or not council supports this as a pilot program, and then if council supports potentially using ARPA funds. That doesn't mean that you're making the decision tonight that we're going to use ARPA funds, but if you're interested in staff exploring that possibility. And Jessica's here to answer any questions, and I know Judge, Chief, or Brooke is also available.
Great. Councilmember Duran-Malika?
Yeah, I have a quick question about the, I guess with the workload between the co-responders and the program manager, specific for the after-the-fact calls, will the community resource navigator get pulled into any of those? Or is it really just going to be the co-responders who manage the after-the-fact?
So the after-the-fact calls from a referral from the police department would be managed by the co-responders. Okay. And that's because if we're calling, the hiring requirements for a co-responder would have that clinician expertise in there, whereas the community resource navigator might not have that clinician expertise in there. So when a police department is making an after-the-fact call for someone that they think is experiencing mental health distress, we really want to be able to provide the right resource for them. The community resource navigator would primarily be in that role for self-identified people, for working with our homeless population. So they would still partner heavily with the police department in regards to our population experiencing homelessness. And then they would work to maintain our office resource hours. The community resource navigator would be able to refer other, like, people that have a higher level of care that's needed to the co-responders for case management. That's the flow that
Oh,
would
okay.
happen. Mhm.
All right, so are we expected to see an increased workload for the community resource navigator? Because you talked about keeping that position as only a 0.5, so would that individual still be able to respond as they currently do?
So the community resource navigator would still respond as they currently do, but what this program would allow us is for the police department to start heavily relying on clinicians that are trained in figuring out if a person's having a mental health crisis, if there's a dependency or a substance abuse issue going on, and making those appropriate referrals that way.
Okay. Is the program manager also a clinician similar to the co-response?
The program manager right now, as we wrote it, is going to be a licensed person, not necessarily a clinician. So a clinician is able to differentiate between mental health diagnoses, substance abuse disorders, and start to be able to make an appropriate referral for treatment regarding those different issues. Whereas a licensed person is just someone that has become either a licensed, I think we said licensed clinical, or I'm sorry, licensed social worker, a licensed addiction counselor, a licensed, family and marriage therapist, or a licensed practical therapist.
Okay, I think one of the questions I just want to try and clarify is that, so if, say, a co-responder goes out maternity leave or goes on vacation, is there going to be enough FTE here to back up people? Because if this process gets up and running, we really want to make sure that, that we have the people to respond.
Yeah, so when looking at other places, especially the ones that have an external model, they have fully employed one individual. So when that person goes on vacation, when that person goes on leave, then there is that issue. So that's why we did 1.75, hopefully that those can complement one another. And then also, even though the program manager would not have that necessarily, they could have that clinician background, but they don't necessarily have to have that clinician background. They would be able to be an appropriate backup, more so than the community resource navigator.
Okay, yeah, awesome. Okay, that really helps with those questions. Hold on, let me just double check here. Oh, I was curious about response times. How does that work with the, so if we have a police officer who calls for a co-responder, are they with them in the car when they respond, or is they come after? What does that response
So
look
the
like?
clinician would not be in the same car as an officer because one of the goals is for an officer to be able to arrive on scene, assess safety. Once the safety is assessed and deemed safe, then they would be able to go back to their patrol duties, whereas the clinician would be able to stay on scene and provide a more in-depth care for that person, that resident, and take the time to do an intake, take maybe a psychosocial assessment, and make appropriate referrals to community services. So they would not be in the same car. So as we said, okay, so we're saying that we're recommending a primary and secondary response. It would start out as a secondary response, and that would be to build that trust between the law enforcement and the clinicians so they can get to know each other, their work styles, their communication styles, and really have a strong foundation for working with one another. After that, then we would look at ways dispatch would be able to call directly for clinicians rather than just law enforcement. So if someone, I've had residents call me directly, say there's someone that I see is in distress. I say I am not an emergency responder. Please contact our emergency services. But if we had the appropriate referral service in place, then dispatch would be able to call for just that clinician, and they would be able to respond without that officer once that foundation is built up.
So secondary first for a period of time, and then we'll be looking at doing a primary.
That's correct. And they would be driving in their own cars. So one of the budgetary items on the itemized list is mileage.
Okay. And then, let's see here. I think those were all the questions that I had. So thank you so much. Yeah, I really support this program. I think it's innovative. I'm excited to see how it would work. I mean, I feel like it could meet a lot of the various needs that we have in our community, as everybody, as all the staff mentioned. And so I'm really excited to just see yeah, what it could go. And as for ARPA funds, we haven't had the conversation yet, but I would be open to including that.
Thanks.
Mayor Pro Tem Wilford, and then Councilmember Goff.
Thank you, Madam Mayor. A lot of the questions that I had were along the same lines as Councilmember Dramolica, and is 1.75 FTE enough? And what happens when, you know, one of the FTE wants to go on vacation or it, you know, has a baby? And, you know, I look at the numbers and the way that you all put together the staffing, and it's so thoughtful. And I just wonder how we're going to see our numbers potentially grow with this becoming more of a resource and a known resource for our officers as well as our community. And I know that, you know, if we do move forward with this pilot, that it is a pilot and we can continue to ramp up. But I guess the question, I'm just gonna come out with it, like, are you sure that this is enough FTE? Like, how are you, like, the way that you've described the jobs, they're big jobs.
They are big
Like, they
jobs.
are not small jobs. I mean, the relationship building, the community trust building, the partnerships, you know, the getting to know other colleagues and working across departments, like, these are not small jobs. And I think a lot of times we talk about our officers' mental health and how we're protecting their mental health. How are we going to protect the mental health of these employees that are going to be coming in and sometimes seeing some really tough cases? And is that something that y'all have factored in to the equation?
So when looking at the FTEs, I have had multiple conversations with different cities as well as Community Reach Center, how they factored in staffing for some of the departments they serve. And then Boulder County, I've also discussed with Boulder County, who has an internal program. Boulder County employs 4 FTEs for the entirety of Boulder County. So, but I'm going to put a caveat, they do not work directly with the 2 other departments that I have said, which is code enforcement as well as their municipal courts or their county courts. So that's where, if we looked at just co-response times, that's where I'm saying it's robust. And then being able to factor in the uniqueness of what we're trying to do in Northglenn is where I think that we're going to be able to have some of those planned times. Because as an emergency response, I do think 1.75 plus having the backup of the program manager, so it's really 2.75 that could be responding if needed, is appropriate. If you looked at the call times, the co-responders would be coming in later in the day and the program manager would start at a more typical early morning slot. So if needed during those morning hours, they would be able to respond during that time. And there is a small call surge during those morning commute hours. So then having the overlap hours, that would allow us to have more of those planned case managements as well as mediations. Mediations is usually a series of at least 4 different meetings between the various parties. And so it would allow for those planned meetings to occur. I do think that the way it's written, with at least the 2.75 being qualified to do those emergency services, and then also having a community resource navigator that is familiar with working with police departments, with emergency services, having crisis intervention backgrounds, they too would be able to assist as needed.
And just to add to that, so that's why, another reason why this is a pilot program is so we can consistently evaluate what we're doing and the call volume that crew is getting. We also want to check in with the police department and code enforcement and the court system to figure out if we're meeting their needs as well. So it's a work in progress. And as a pilot program, I think it gives us flexibility to continuously evaluate and report back to council.
Okay, did you have more?
I do.
Okay,
To address the mental health concerns of the clinicians themselves, usually when you are either a social worker or a therapist, it's typically advisable, if not fully ethical, for you to be participating in consultation or your own therapy or mental health support yourself. And so that kind of goes along with those professions.
Okay, perfect. I appreciate that explanation. I am in 100% full support of moving ahead with this pilot program. I feel like this is something, to Chief's point, that we've been asking for and pointing to, at least since I've been on council. And I know every single staff member that interacts with the public, as well as probably every single council member up here on the dais, has a story or has an example of a time at which one of these co-responders could have been utilized, right, to diffuse a situation or get somebody the help or the support that they needed. So I think that this is a really innovative way to move ahead, and especially an innovative way to get folks the help that they need without putting them right in the middle of the justice system, right, in order to get that help and support that they need. So I'm open to looking at ARPA funds if that's something that the rest of the council is interested in. I'm just over the moon that this is finally coming to fruition and that Northland, is that our residents are finally going to have these valuable resources available to them. So thank you for coming forward.
Thank you.
Councilmember Goff?
Oh, thank you, Mayor. Yeah, I do also want to thank you because I could see a lot of work was put into this, a lot of research and just, creative thinking. So I'm very impressed. I support the program as well. And since so many great questions have already been asked, I just have one. And that was in some of the data that you presented earlier on, there were some places where the numbers were unknown. So going forward into the future, do we have ways built in to kind of track that kind of stuff better so we wouldn't have these unknowns?
Yeah, I think it would be interesting to look at our own numbers if those were the actual numbers that we wanted to know. The initial thought is to follow the data that was already being collected by Office of Behavioral Health, so that if they are looking at assessment and that's the data that they're used to, that the assessment tool would follow that data. If we wanted to have our own internal data as well, looking at past call logs versus future call logs, and that could be written in as well.
Sounds great, and I do support this one.
Thank you.
I had a couple of questions. First, I wanted to say thank you for presenting, but also thank you to staff for all the grant writing. That is not an easy thing to do, but it's very appreciated because it obviously helps with these types of decisions, but it looks like there was quite a bit that was done there. I also had the question about why part-time. I've never quite understood a 0.75 unless there was an individual that wanted to work 0.75, that we were trying to create a position to make them happy. So I just didn't quite understand that piece. And then I did also share Councilmember Peterson's question about the schedule and the lack of support over the weekend. So I don't know if that's perhaps something that could be changed if we increase the FTE, if there would be more space for weekend support.
If FTEs, yeah, I tried to, so looking at the increase, so I think right now it's an increase of 2.75 FTEs total. And so trying to keep budgetary thoughts in mind when writing it. But if there was an increase in FTEs, you could either do another 3/4 FTE slot and do another 3 10-hour days, which would increase the weekend coverage, or you could do another full-time FTE and have more of that crossover go into nights and weekends as well. 0.75 to 1. Oh, I thought we were just adding a whole other one.
I know, you know what, add what you need. I guess I was just more concerned about the lack of coverage on the weekend.
Yeah, so if we increase the 0.75 to a 2, I did not find a way to increase that to cover the weekends, mostly because we would need those overlapping hours to provide case management and conflict resolution as well as restorative justice. So that's why the weekends were not looked at at this point in time.
Okay, well, and maybe, as we go through and evaluate the program, maybe that'll be seen as a need in the future. The other question I had was, I didn't quite find pilot until the very end.
Can I say one more thing on that? When talking to our officers, another thing is that our call log, or when talking to officers, call logs tend to go up on Mondays as well because a lot of offices that serve mental health are closed over the weekends. So if people are making calls, they typically don't do that over the weekends. Even though our call logs do go up over the weekends, it's unclear if that's just mental health holds or if that's more to do with safety concerns. We don't know that data. So I should clarify that. Okay. So I did have that conversation with some officers.
Okay. So going through the presentation and the memo, the pilot component comes up at the end because you're talking about the ARPA funds, right? Which I get. So I think one thing I would like to see, probably sooner than later, is a refining of the measurement piece. You know, because you had the little asterisk, like, and so many other ideas, right? I'd like to see the so many other pieces. And then I was wondering, like, if, because it just didn't seem finished, that, the goal part.
The measurements.
Yeah, and how you were gonna set the goals and measure them. And then, like, if the goals aren't met, is it just at the end of 2 years, no more funding for you because it didn't work? Or, I mean, I guess I would just want more information about the pilot component.
Yeah, so when we were setting up this presentation, we really wanted council to get an understanding of what the purpose of the program was, as well as put some structure to it. So you're right, we don't have all of the metrics set out yet. So we can certainly come back either through email or if you want to follow up in a study session, more specifics on metrics. So that's something that we can certainly do at a later time.
Okay. I mean, I do support it, and whatever way, I guess the funding question for me, I'm sort of on the fence about the funding part, and here's why. Like, to use the ARPA funds to have a pilot that is very measurable with specific goals and metrics, that's one thing. If it's an ongoing program, you know, where does it fit in the budget process? You know, because I would hate to be like, oh, we love this, we made the general fund decision, and then we got to the budget process and went, oh, we can't afford it, sorry. You know, like, that's a concern, because it's a lot of money ongoing. Either way, whether it's ongoing or a pilot, we'd want to have the metrics to make sure that we're making the most use of our money. And then, so then I had a question. So say we get down to a budget process, is this we are 100% supportive of this package, or we are not? Is there, like, well, we love it, but we can only afford this much? Like, is there a modification piece, or is it just 100% yes or no?
Are you talking about for this year, for this next fiscal year, or
Just
ongoing?
Ongoing.
Yeah, so I think in terms of ongoing, that's where we want to check back in with council after year one, after year two, to show you what we're accomplishing with the program, so that council can make that determination whether ongoing you want to fund the program using general fund money, or if, you know, there's potential for grant funding. In terms of your question about ARPA funding, that you would feel more comfortable spending that amount of money after you know how we're measuring success and how we can let council know this is how successful the program is based on these specific goals and metrics. We can come back to you with that information.
So knowing how much ARPA funds we have and the fact that this falls underneath it, I would rather do the pilot version with the ARPA funds with a bigger FTE.
And so when you mean a bigger FTE, do you mean from 0.75 to making that 0.75 person a one FTE, or adding?
Well, I think it's what you might need, right? So if you were given more flexibility, if we were really looking at increasing, instead of from the 2.75 to 3.5, or I don't know, something different,
Look at the weekend coverage piece
Yeah,
that
look
I'm
at-
hearing from a couple of you.
And looking at, like, I mean, not really, but with the ARPA funds, your proposal is a small chunk of the ARPA funds.
Right.
And it makes a lot of sense to use that money, but if we're gonna do it, let's do it. Let's do it. And let's measure it, and let's knock it out of the park and really support people with this fund.
Yeah, I mean, if that's an opportunity, then I don't think anyone's on this side is going to say no. I think that would be welcomed. I think being able to, the program is written for it to be fully staffed for those 5 business days. If we wanted to extend to weekend coverage, then we would need to be looking at more FTEs. And to think about doing that is exciting. So, all right, I'll say that.
Okay. And then I would be remiss if I didn't ask, because I've seen you in action. Are you applying for one of the bigger jobs? Can we get you more than 0.5?
I would have to go, we're going to follow HR recommendations, so it's been put out to HR.
Yeah, so if this
She
is
knows
something that council wants to support, how we would advertise the position, we would have the program manager follow, the typical HR protocol of advertising first internally. Whoever wants to apply for it internally would have to follow those HR procedures.
No, I totally know we're going to follow the rules. I'm just wondering if you're interested in applying.
Any internal staff wants to apply.
Okay.
They're giving you the appropriate
Yes.
response,
You're being
ma'am.
very polite. Okay. All right. Well, I will put my 2 cents in because you are invaluable and I've seen you firsthand with residents and our program would be very, it would thrive under you. So that's my 2 cents.
Thank you for those thoughts.
Councilmember Peterson and then Councilmember Wick.
Thanks very much. Just a couple things. When would you anticipate this beginning?
Yeah, so I think that would depend on whether or not we got the COPS grant.
Right,
So
and
if
that
the-
was-
Yeah, so COPS grant, that award is expected to start October 1st,
If we receive it,
if we receive that grant, yeah.
and that's for the 2 grants.
Yeah, so each grant is a separate award, but they both start on October 1st. So we should get notified by the end of September.
Okay.
And part of the other piece, if I can interject real quick, Councilmember Peterson, is if council, generally speaking, is supportive of using ARPA funds, that could speed up our timeline because that money's available sooner than, say, the 2022 budget. So we're looking at both options as Jason and I work through the budget that's going to be presented to you on September 13th.
Okay, thank you. And then I know we tried to have this conversation with the CCPP, and you indicated that we had talked about it and we had not because of technical difficulties. And so is this something that it's not a hierarchy or anything, but I would think that conversation might be moot at this point if council's in favor of this?
So we did actually present during the July 13th CCPP Advisory Board
That
meeting.
one, okay,
Yeah.
okay.
And Jessica, so if council wants to move forward with this program, our intention is to bring it back to CCPP and the DICE board, with Jessica this time being at the CCPP board, to talk more through those goals and metrics that they want to see us include in this program.
Thank you.
Councilmember Wick.
Oh, thanks, Mayor. I don't have any questions because everybody has already asked all the great questions, but I did want to thank you for this. It's very thoughtful and it's exciting. So thank you to Rupa and Jessica and all the staff involved. I would share Mayor's suggestion about adding more FTE. And I'm definitely open to looking at using the ARPA funds as well. And I guess it goes without saying that I definitely support the pilot program. So thank you.
Councilmember Lukman Hiramasa.
Thank you, Mayor. So you both know how excited I've been. I've been waiting anxiously to hear this presentation, and it was everything I expected and more. You both did a fantastic job. Jessica and Rupa, you're both amazing. I think this needs to happen yesterday, so I agree with the urgency, and if the ARPA funds help speed that up, I would definitely support that. It was very well thought out. I'm very proud to see the ownership from MPD and from code enforcement in terms of there's gaps that need to be filled. So I think that says a lot about Northland as a city, and just how amazing the city is in terms of taking that proactive stance with issues like these. So with that being said, I think every question I had was answered one by one from all these brilliant council members. I'm also in support of covering those weekend hours if that's a possibility and adding that FTE. I think that's important. If we're gonna do it, might as well do it right, is my thoughts. Thank you both.
Thank you.
I don't see any more hands up, but I do believe, just to kind of circle back on council members that commented at the beginning, how do you feel about ARPA funds and an increase? Okay. Well, that sounds great. Good luck.
Good luck.
Thank you.
Thank you all for your time.
All right, our final item tonight, City Council Committee and Liaison Vacancies. City Clerk Joanna Small will introduce this item.
Good evening, Mayor and Council. The purpose of this item is for Council to discuss filling the committee and liaison positions, the vacancies that were created when Councilmember Escobar resigned earlier this year. The current vacancies include a Council Finance Committee member, an Outside Agency Funding Committee member, the Adams 12 5-Star Schools Board of Education Liaison, and the Northglenn Senior Organization Liaison. So previously, committee positions became vacant when former Mayor Dodge resigned. However, those positions were filled by other council members after Councilmember Escobar was appointed to serve as the mayor and before Lauren Rodriguez was appointed to fill the Ward 4 vacancy at that time. So this situation is a little bit different. There are 3 options that are identified in the staff memo. Those include, the first one is to appoint Ward 4 Councilmember Shannon Lukman-Haramasa to fill the positions. The next is to appoint other council members to fill the vacancies if there is interest in the positions. And the third is to leave the positions vacant until the 2021 to 2023 committee and liaison appointments are made following the November 2nd election. So staff is asking council to provide direction regarding the vacancies. If council desires to fill the positions, resolutions for the appointments can be prepared for the August 9th regular city council meeting, and staff is happy to answer any questions you might have.
I have no questions. I just move that Councilmember Lukman-Haramasa take the vacant spots.
Can I just ask if she, I mean, could you do them? I mean, that was a lot.
Yes, actually, I raised my hand, so if it's okay. I'm not sure what to do with myself.
Okay. Would you like the floor?
Yes, actually, I would absolutely love to fill those positions. It doesn't make sense if they're empty and they'll stay vacant until November 2nd elections, then I'm happy to fill that spot in the meantime and perhaps bring any useful information back to council. So I'm up for the commitment. I'm in 100% and I'm happy to step in. You guys love.
Amazing.
Sorry, I did run that by her before, didn't I? I didn't just throw her in that.
Oh, you wanna?
Sure, she's doing it.
Well, thank you very much for serving in that capacity. We appreciate it. Okay, well, that was it. We made it. Are there any other items for council tonight? Well, our smallest member was very well behaved.
Thank you, Caroline.
She's so cute. All right, well, have a great evening. We are adjourned.
Thank you.
Thank you.
Good night.
Gonna
Good night.
used to waving at